Now, for those that don't know about us at ColumbusBlack.com, who are we? We are an omni-channel platform serving the Black community. We are the connection between commerce and culture to the Black community in Central Ohio. We have been around since 2005, and we are ecstatic about the ability to be around for 17 years, providing a service and being a resource here in the Black community. Tonight, we're going to talk about something extremely important to our community. For those that don't know, this is something that we have been doing ever since COVID kicked in. We've been hosting an event called Wellness Wednesday. It addresses the socioeconomic components of our community. That could be anything from education to health to mental health to finances and resources that are tied to our overall well-being. Well, today we're actually talking about the overdose, the alarming overdose rate in the Black community, specifically in Franklin County, as it is related to fentanyl overdoses, okay? So with me today, I have a special guest by the name of Nathaniel D. Jordan II. Now, Nate, as I call him, is the Executive Director of Fatherhood Matters program for the Columbus Kappa Foundation, where he has the overall strategic and operational responsibility for Fatherhood Matters, the staff, the programs, the expansion and execution of its mission, which is tied to what we're going to hear about today. In addition to that, he comes to us with an extensive amount of experience as a former chief operating officer for AT&T and Lucent Technologies, where he was responsible for managing a $2 billion budget, which entailed managing a complex set of business functions in a large region, evaluating and responsible for the return on investment and overall profitability in that region, reporting directly to headquarters and top executive management. Clearly, Nate comes to us with an extensive amount of experience. He is seriously focused on our community and helping people as well as saving lives. Today, we're going to talk about a number of things, and we're going to talk about solutions as well. With that being said, Nathaniel D. Jordan II, I'm going to turn it over to you and allow you to share a little bit about the topic of discussion today, how you got involved with that topic. And then I know we have a very streamlined and very specific agenda that we want to get through to make sure that our audience and our community is fully aware of how serious this issue is, but also how we can help remedy what's taking place right in front of us every day.
Well, Brother Lloyd, first of all, I want to say thank you for having me.
Absolutely.
Columbus Black has really did a lot to leverage the cultural awareness of Black Columbus. And I truly appreciate that, because we need to have a media where we can get informed, get information. Again, I want to thank you. The Columbus Kappa Foundation Executive Director, as Mr. Brother Lloyd told you. Also, we're Opiate Community Connectors, and we work with the Project Dawn. We're a Project Dawn agency, which distributes Narcan, which we'll be getting into. But what we want to talk about tonight, though, is we want to talk about Franklin County and Ohio and the zip codes in our Black neighborhoods and why we are dying. Now, who in the audience has heard of fentanyl? Raise your hand. Probably just about everybody has maybe heard of fentanyl. But what is fentanyl? What is fentanyl? So what we're going to do is, first of all, I'm going to go over what fentanyl is. And then I want to give you some startling statistics regarding the state of Ohio, Franklin County, and the city of Columbus. But then what we're going to do is we're going to provide some solutions. Because, see, one thing that it always kind of puzzled Mr. Brother Jordan here is everybody has a lot of things they want to do, but who's providing solutions? Tonight, I'm going to bring you solutions. We're going to bring you solutions developed by the Ohio Department of Health in conjunction with Project Dawn and my partner, Harm Reduction of Ohio. We all put our collective minds together because Blacks were dying, not only in Franklin County, but all over Ohio. And we had to figure out why. So let's get started. What is fentanyl? What is fentanyl? Fentanyl is basically a synthetic opiate typically used to treat patients with chronic pain or severe pain following surgery. So if any of you out there have had surgery lately where they put you totally under, where they had to maybe replace a kidney, or just like me, I had hip replacement surgery, they use fentanyl along with the general anesthesia. Fentanyl is a Schedule II controlled substance, okay? It's similar to morphine, but it's 100 times more potent. And check this out, it's 40 times more potent than heroin. Now, here's what's happening out here in the streets. Here's what's happening in the streets. Fentanyl is being mixed in with other illicit drugs to increase the potency of that drug, okay? It's sold as powders, it's used in nasal sprays, it's pressed into pills, it's made to a liquid, it's also it's mixed with the other drugs. Because of its potency and low cost, drug dealers have been mixing fentanyl with other drugs, including heroin, methamphetamines, cocaine, along with marijuana. Now, Brother Lloyd, what do you see that's in common with all the different? Go back to the other street. What do you think is in common with everything I just told you? It's what? Common what you call street drugs. Street drugs. Just quite frankly, in a lot of states, marijuana is legal now. Mm-hmm. So what we want to do is we're going to get in, Brother Lloyd. We're going to get into some statistics, and these statistics are going to be provided by the Ohio Department of Health, also with some of your county coroner's offices. But what we want to do is, first of all, we want to make sure your audience is provided with the statistics. Okay, so guys, hold on to your seatbelts because we're going to go through a few slides here, and we're going to justify or document the serious matter that we have with Blacks in Ohio. Then we're going to break it down to Franklin County. And again, then we're going to provide some solutions. So, race and overdose death in Franklin County. As you know, we work with the Ohio Department of Health, and we're a Project Dawn agency, the Clemens Kepler Foundation. Next slide, please. Now, what you have here is overdose death rates for white and Black in Ohio. Now, if you look at that graph, if you see, as you see, from 2010 up to 2018, the whites more or less were dying more than Blacks, right? Why? Because at that time, whites were the ones that's using the pills, the opiates, the Percocets, the Oxycontins. Whites were the ones who were able to have a doctor, medical insurance, and they were able to have prescriptions to get these said drugs. Because you guys probably thinking about the pill mills, right? Yes, pill mills. But look at 2018. You see that graph going up, and Blacks are now dying more than whites in Ohio overall. That is the infusion of fentanyl in the Black community.
Wow. Clear as day.
Clear as day. Now, this is again from 2010 to 2020. Go to the next slide, please. Okay, now, here's where we're going to make some differentiation. And this is why Brother Jordan feels that we as a state, we need to look at our policies, because if you look at this graph here, true enough, this is white versus Black residents and heroin overdose. As you see, the whites throughout 2010 to 2020, the whites have died more than Blacks in heroin because, or opiates or Percocets and all that, because that is a drug of their choice, and that's what was accessible to me. Okay. Now, most of your policies that you have, that you hear about, is basically centered around the pill mill environment. Most of these individuals, again, are more affluent. So when you think about opiates, you think about overdose and opiates, you naturally go to think about people on pills, taking those opiates, Percocets, and happen to get some fentanyl every once in a while pressed into one of them. Okay? Now, go to the next slide, please. This next slide is the cocaine overdose. And what do you see different? What do you see different, Brother Lloyd?
I was on mute, but you could see that, yeah, obviously that in this case it's inverted, right? In regards to cocaine overdoses in the Black community being much higher than in the white community, clearly.
Yes. Okay. And again, what do you see, Brother Lloyd, when you get to 2018?
We see a spike.
What is that? You see a spike.
A spike and a noticeable gap.
A noticeable gap. Okay. Now, go to your next slide, please. Now, this is cocaine containing fentanyl. It's off the charts. And this is 2022 right now. And in 2022, Brother Lloyd, here in Fentanyl County, man, we're dying. It's 4-1. But if you can see on this chart here, cocaine, which is cocaine powder, cocaine rock, crack cocaine, fentanyl is being included in there. Now, I'm gonna tell you something startling that you probably didn't know, and your guests out there in your public probably didn't know. Crack cocaine and the infusion of fentanyl is killing our Black men, and the average age that they're dying is 66 years old.
Wow. That's
a
lot higher than I would expect.
Well, it kind of shocked me too. But then I peeled the onion back, Brother Lloyd, and found out that, 40 years ago, in 85, 83, when crack first hit the Black, it was infused into the Black community and became such an epidemic that it was never addressed as a mental health issue. It was never addressed as somebody being sick. It was addressed that you're going to jail for life, okay? So it never was addressed the way this is being addressed today, okay? That's here nor there. So those same Black guys who were smoking crack then, 40 years later, they're still smoking crack because they're recreational crack smokers. So now I'm a recreational crack smoker, Brother Lloyd, and I buy some crack. It's laced with fentanyl. I hit the fentanyl and I'm dead.
Wow.
Okay. Just like that. Marijuana. Marijuana is legal now. Some cases, matter of fact, you can go to Detroit or somewhere, you can buy it anywhere. You can order it in the mail. And so you've been smoking, you smoke weed, kids smoke it, teenagers, young adults. I mean, you got an array of people smoking marijuana. And what they're doing is lacing marijuana with fentanyl. You hit a joint, and boom, you're dead. Go to the next screen,
wow.
Please.
Something else that I noticed on this particular slide is that these numbers, right, and this is in regards to drug seizures, right, 2014 to 20.
Yes, drug seizures, a drug arrest.
Yeah, so it's interesting seeing how it spiked, around the 2017. Then those numbers came down quite a bit, and then it shot right back up, right around. It looks like going into 2020, and then 21 at its highest rate. I would expect 22 is probably somewhere near there. Hopefully it comes down. Yeah.
Let me tell you what happened here. Great observation. What happened here was once you had that spike right before, right in middle of 2019, COVID hit. COVID hit, and the actual the seizures went down. Okay, but then you got near the end of 2020, you got now you get the CDC money, and that money you got from the government, which put a lot of money back into the economy, and you see it's off the charts.
Yeah.
Okay, so that there, and think this is just what was seized. Think what was the seized. Next slide, please.
All right.
Now, this here is the percentage of deaths involving fentanyl of Black residents in Ohio. Okay, in 2010, it was 0.
Wow.
Come on. 5 years later, it grew up 27%, which, I mean, still increased. But if you notice from there on, the remarkable increase of fentanyl in our Black residents dying.
Wow.
This is deaths, and this is not Brother Jordan talking, it's not Brother Jordan talking, Brother Lloyd. These are facts. These statistics come from the Health Department.
Yeah, this
so,
would. Yeah, go ahead.
And I can sit up here all night and tell you things, but I wanted to come with statistics, because that's what I do. That's what I do. And this here is alarming, but you're going to see some more numbers. It's going to be more alarming. But you know what, Brother Lloyd? We do have a solution. Next slide, please.
All right. Before we jump from this slide, I'd just like to say, I mean, this is a significant jump over a 5-year period from 2015 to 2020. That number almost tripled, right? It's literally like 300 basis points from tripling in that time frame. I mean, this is staggering, and it should be alarming. Wow. Okay, go ahead.
Well, and I'm glad you said that, Brother Lloyd, because you as a layperson, and I deal with this every day, and I hope that people who are in your listening audience, it has a profound effect on them, actually see the numbers. But see, it's not always a Black thing either. It's also a white thing when you come to from an economic standpoint. Right. Okay, you got your affluent white people, right? Then you got your white people that's not affluent. Mm-hmm. And those low-income white people, which they normally call white trash, they use methamphetamines as if Blacks use crack. Okay, so look at this rate. And I'm an advocate. A lot of my zip codes here in Fentanyl County, I deal with Sullivan Avenue, I deal with Parsons Avenue, I deal with every one of the Broad Street, West Broad. I deal with white and Black, okay? Because in my zip codes, white Black neighborhoods where white people live in, they dying just like we died. All right, so I want to make sure that your listening audience and the people who I engage know that, yes, I'm looking at the problem in the Black neighborhood, but this comes to an economic type of thing, my friend. And a lot of times it comes with how much money you have or what type of treatment you can get. See? So it's not always Black and white. See, people always try to cast you into a Black and white type of casting system. If you read that book, you know what I'm talking about. Anyway, but it's not always casting. It can also, it's mostly the business. It's economics. Who got the money? Okay, so you see meth overdose rate, whites, again, doing more than Black. Next slide, please. Okay, meth containing fentanyl. Again, these are drug seizures, but you see how that's going off the chart too. So fentanyl, whether it's being put into meth, whether it's being put into marijuana, whether it's being put into cocaine, crack, it's going off the charts. Okay? You got anything to say, brother Lloyd?
Shaking my head. It's an issue. It's
Yeah,
an
man. I
issue.
thought, yeah, hey, man, it's really something. Next slide, please. Okay, now, here's what brings us home. This brings us home right here, okay? This is heroin fentanyl versus cocaine fentanyl deaths. And really, you can just look at the graphs and just see that it's way out of proportion.
Yeah.
It's way out of proportion. You know, we're gonna, you know, it's so far out of proportion, especially when you talk about blacks are roughly 16% of the population in Ohio, and almost 40%, almost 30%, 32% of the overall deaths of fentanyl. It's crazy. Next slide, please.
You know, this is
Okay,
another
great.
interesting slide when you see how it flipped, right? From the left side, right? From 2017, before 2017, it flipped in regards to heroin,
Yeah,
right? Versus
yeah.
cocaine, taking the lead since then at a very quick rate, going from, you know, probably 20, 30% higher to 50% higher to literally for almost 400, 300+%
Well,
higher. Wow.
well, you know, I could say this, that it's no accident, okay? And just like this chart here tell you is, you know, that just the amount of deaths that, let me get mine out so I can see it better. Yeah. You know, you're looking at overdose deaths, this 2020, 2 years ago. You know, you're looking at, again, fentanyl alone. You know, people are actually doing fentanyl by itself.
Mm.
Yeah, I got some stories for you. 37%, 48% of cocaine, and those numbers are consistent with what we've been seeing. Okay, and the thing that is the thing that really is the most disheartening is that in that 2018 period, that is when there was an influx of fentanyl in the black zip codes. And I don't know why and how, and you know, but I just know that the numbers speak for themselves. And as you had mentioned, you've seen yourself, Brother Lloyd, the dramatic increase that we had with that with those numbers. And this is just is something that all of us should be not only alarmed, but we have a solution. We have a solution. And next screen, please.
Okay. I'm just still absorbing how
okay,
high.
Yeah, good. Talk
Yeah.
us through it, man. Talk to your audience through
it. Yes. Yeah. So as I go back, first of all, alarming for you to say fentanyl alone. That's number one. I mean, based off the information in regards to the potency, like, I mean, it's almost like asking to die, right? On something this powerful.
Yeah.
But then I'm thinking about the accidental deaths, right, that are being caused from those who have been using these particular drugs, right?
Yes, sir.
Those that may be addicted, that have not been able to get off that addiction, have not had the support, resources, whatever it may be. And, and then this habit, due to this habit, and this addiction, end up in a situation where something is laced with fentanyl. Yeah. And all of a sudden, the whole situation changes. So,
Brother Lloyd, what's so startling about this? During the during New Year's holiday, right? Between New Year's Eve and New Year's Day, 18-hour period, we have 14 drug overdoses in the black neighborhood. 10 of them was accidental. See, and 10 of them were at somebody else's house when their relatives came over to watch the football game.
Wow.
Go in the bathroom. They've been gone for 20 minutes. Go in there. They OD.
Wow.
Okay. Now, this chart that you just pulled up, I hope we can see, your people can see this. This here is the lay distribution, Naloxone, Franklin County Lay Naloxone Distribution Network. No, I'm sorry. This here is the overdose deaths. This is the overdose deaths for zip codes, because I couldn't hardly see it. This is zip codes, right? In Ohio. And all the zip codes you see in red are from Franklin County. Look at those, Brother Lloyd.
1, 2,
14 of the top 43 reside in Franklin County. Look at that. What is it,
That's so you already know how I am resolution based. So I'm quickly wanting to get to how do we resolve and help this. This needs to change. So
we've come up. If you can get to the next screen, because that there just that speaks for itself.
Okay.
And now what we've done with the Ohio Department of Health in conjunction with Project Dawn. Project Dawn is death avoided with naloxone.
Okay.
Project Dawn has been in existence for over 4 years. We presently have 109 agencies, and what we do is we distribute Narcan free to our community. We do training, we do education, we go around and we pass out literature, and we do everything within our power to get Narcan within someone's home, in someone's hand. So what happened, the Ohio Department of Health and Project Dawn and the Columbus Capital Foundation, with the Columbus Capital Foundation being an opiate community connector for the last 4 years, with the Adam H. And I want to say thank you to Adam H. for a great partner of ours. Erica Clark Jones and her team, excellent, love them. Anyway, with our community connectors, and then we started doing Narcan about 4 years ago, which is a different division of Columbus Capital Foundation. But we got a partnership with Harm Reduction of Ohio. And Harm Reduction of Ohio is ran by Dennis Kashan, the CEO, and they're responsible for distributing naloxone in all 88 counties. They distribute in all 88 counties. So we got with them, and then we start distributing. They gave us our own agency. Okay, so then all of a sudden we said that what happened was the governor had gave out $2.8 million worth of free naloxone, but none of the black zip codes got it in the state of Ohio, because their numbers weren't high enough because of gentrification. So I brought it to the governor's attention. We brought it to the governor's attention, and they said we had to do something. So it was a collaborative effort. And I'm gonna tell you, man, when you see the government, business, and private nonprofit like myself all work together in unison,
right,
to solve a problem. I've been doing this for 4 years. I'm the needle, and I got the thread. They're giving me the ability with a pilot project.
Okay.
And the pilot project is a 6-month project.
Yeah.
And it's called the Targeted Community Lay Distribution Network Pilot. And the purpose is to address the issue of increasing overdose death rates and the associated racial and ethnic disparities within our community,
Okay.
thus being the delayed Narcan distribution network. And if you write that number down, and the next, I'm going to show you some of our locations, Brother Lloyd, that we're currently within our distribution network. And you'll be surprised at some of the ones that we have, and we're getting more every day. Because our goal is to, in those same zip codes that you looked at for Franklin County, in a year or so, when we go back and do those zip codes, we're going to see a marked difference because the Naloxone is going to be in those neighborhoods. They're going to be in those households. They're going to be in those community centers. They're going to be at those rec centers. They're going to be in those churches. They're going to be at the stores. They're going to be at the filling stations. They're going to be everywhere because that Naloxone brings back life after opiate overdose.
Wow.
I'll tell you, Brother Lloyd, just an example. We had a table down at Mamie Moore Park at their first music festival last week.
Yeah.
And we were passing out Naloxone. And actually, we passed out 260 units, man. 260 units. Anyway, a guy came up to me. He said, "Hey, man, how you doing?" I said, "Hey, I'm doing fine." He said, "Man, remember you gave me," he said, I work for Coda. "Remember you gave me a couple boxes of Naloxone, we call it Narcan, about 2 months ago?" I said, "Yeah." He said, "Man, you ain't gonna believe what happened." I said, "What?" He said, "Man, I was on the bus driving, somebody OD. So I started to panic. I started to panic at first, but then I remember what you said, and you gave me your brochure. You know, you gave me your brochure, and I pulled your brochure up and looked at the instructions. What to do? Got the dude conscious. Called 911. Lady, he was on his back already. Administered the Narcan to him. Laid him on his side in the recovery position.
Yeah.
He came back to life.
Wow.
EMS came, got him. He came back 2 days later, crying, thanking the bus driver for saving his life. Don't tell me this stuff don't work.
Wow.
Hey, I was going up to on Allen Creek, at that fish store in the corner, right? I get out of my car and the guy's laying on the sidewalk in front of the store. They couldn't open the store door.
Okay.
And I shook him. He woke up a little bit. I called 911. I gave him the Naloxone, put him on his side. He threw up. You gotta put him on the side because they throw up on you.
That's the recovery. That's the recovery position, right?
That's the recovery position. You gotta put them on their side because when they throw up, they go out here. But if you lay on their back, they'll drown their vomit. Right?
Yep.
Okay. So I administered to him. Now, one thing, your audience, you gotta realize, once you administer Narcan, be cautious. But sometimes they come out of that stupor, wow, and angry.
Oh wow. Yeah.
Number one, you mess up their high. Okay. Number two, they were more or less dead for a few minutes. Then it shot back to, because what Naloxone does, Naloxone actually, it inhibits the passage of the drug into your bloodstream, because what an overdose of opiate does, it stops your breathing.
Okay. Break it down. You're dropping gems. Hey, y'all, these are called gem drops. He's dropping gems. So that's what happens when somebody's ODing.
When somebody's ODing, what's happening is their body shuts down your breathing function. You can't breathe any longer. Then the more you try to breathe, it works your heart more. Then if you got a weak heart, you can have a heart attack before you die of something else. Okay? So what happens with the Narcan, it's called a blocker. It inhibits it. It shuts off the passage of the narcotic. Now, one thing you gotta know though is Naloxone is only useful for overdose of opiates.
Okay. Okay.
If you OD on cocaine, if you OD on meth, if you OD on crack, if you OD on marijuana, and use Narcan, ain't not gonna happen to you. It ain't gonna hurt you, but it ain't gonna, it ain't gonna come back from that.
So
this is
so hold on a second. So what you're trying to tell me here is, if somebody happens to have some marijuana that's laced with fentanyl, and they
that's
OD,
different.
That's
different.
That's
different.
Okay.
What's fentanyl? Fentanyl is an opiate.
Got it. Okay, good. So break that. There you go. Break it down. That way we could be clear. Because when you say it works with certain things and not others, we want to make sure everybody understands that.
Good point, Brother Lloyd.
Yeah.
And that's why you make the big bucks.
Trying to be like you, man.
I'm an old guy. Hey, yeah, man. I tell you, one of the things, Brother Lloyd, that we have to also realize is that this is a sickness. But
Absolutely.
Let's go to the next slide, because I want to
keep it moving.
I got some more stuff. Yeah.
Okay.
Now this here is our current. Now this is all current. These are our current distribution team. Could you turn that sideways so you can see better, or make that little more user friendly, where I can at least see the names of the companies?
Yeah, it's horizontal on my end.
Okay. Well. Anyway, good. I got this little phone. As you see, and we've got a few more. We got about 10 more organizations, but Afrocentric Personal Development. They're part of the Kappa Foundation Narcan Youth Distribution Network, and that's Jerry Saunders' organization on Livingston. Jerry's been doing that over 20-something years.
Shout out to Jerry Saunders, y'all.
Shout out to Jerry Saunders. He's a great, great man, and he's part of our team. First Step Recovery Center, Cornerstone, Arizona, Outreach. Now, all of these are on the hilltop, west side. The Omega Foundation. Hey, that's our brothers. That's our first cousins of fraternity. That's Omega Psi Phi Fraternity, 1911. The Omega Foundation is part of this team, and they are doing a great job. Okay. Shout out to the Qs. Shout out to the Qs. Hey, that's right. The Mighty Acorn. Mighty Acorn is right on Cleveland and 16th. Right in the middle of Cleveland Avenue and 16th. Right in the middle of the area. Then we got Black Women's League of Voters, Second Baptist Church. Man, Second Baptist Church, man. I had a trainer over there. Man, they had over 40 people. They are so active. They are so active with this distribution network. I love it. I love it. Then you got New Caesars Treatment Center. New Caesars Treatment Center, they're a big treatment center out of Florida. Okay. And they got a location here in Columbus and 6 other locations in Ohio. But they bring a lot of corporate resources here and a lot of corporate resources to our distribution network. And we're glad to have them because they do add value, and they're able to partner up with our other agencies because they are a major corporation. So hats off to New Caesars Treatment Center. Men for the Movement. Men for the Movement has been around for 20 years. That's Cecil Ahid. That's my cousin. And he's been doing great work. He's doing infant mortality work too. Men for the Movement. Divinely Restored Citizens. Now, Divinely Restored Citizens, that's another one of Omega Brothers. But those are guys that's getting right back from prison. So we got them helping us out. Wizards of Hair Care. Wizards of Hair Care, their hair shop is right there in the epicenter of drug use. It's right on 20th and Mount Vernon. Wizards of Hair Care, go through there and get your free Narcan. Manifesting Excellence, great organization, behavioral health firm up there on Bryce Road. New American Resource Center. Now, these are my Somali brothers. These are Somali brothers, man, and they're over about 4 zip codes, and they're doing such an outstanding job. And let me just tell you what happened to them 2 months ago.
Yeah.
2 months ago, they had 10 deaths between 15 and 18 of teenagers smoking marijuana. Marijuana was laced with the fentanyl. They had 10 deaths in a 8-hour period.
That's tragic,
So,
man.
That's tragic. So they're working with us. And what's good about this too, Brother Lloyd, is we're also providing the cultural bridge for that Somali universe. So I've been doing a lot of work within that universe, collaborating, showing and letting them know from the fruits that I have and from my African DNA, sharing my African DNA through their African DNA, then our African ancestors come together and in unison, we become stronger. Let me get off that. But anyway, also the Nutter Center for Empowerment. So these here, Brother Lloyd, if you're recording this, they have phone numbers there. They have names, contact names. So if anyone needs any free Narcan, if you want to join us, just call them, and we can set up where we can come out and do trainer, train you, sign you up to be in a distribution network or distribution team, and we can continue to build this. Next slide, please. Now, Naxado is by Hikma. Hikma makes this Narcan or Naloxone right here is 8 milliliters. Okay, when it first came out, it was 4 milliliters, where you had to do, it was 2 different administrations in most cases. What's good about this Naxado is it's an 8 milliliter, so there's enough medicine in there to stop in one dose the onset of action. And so in my distribution network, that's all we're using is Naxado made by Hikma. Now, Hikma is a very, very industrious company, because what they did is reached out to me and just asked me, just down to earth questions about what is the real need out there. What is really going on out there. I really appreciate them and all their management team. And they have the contract now with the Ohio Department of Health to supply Naloxone, Naxado to Ohio Department of Health. But again, they're a very good partner, and I'm just pleased to have them. So what we're doing, Brother Lloyd, is putting this pilot together.
Okay.
They said we couldn't do it. See, the general consensus, I'm gonna get raw with you. Can I get raw with this a little bit?
Go ahead and let it come on, drop it. We're here.
I'm gonna get raw with you. See, what happened was they felt that we're gonna give this Black organization an opportunity to see if Blacks can work together. Okay. But in the general consensus, they're not going to be able to do it. When have they ever did it? Or they have done it, but are they going to be able to do it on a grassroots magnitude with a short window?
Okay.
Because that 6 months is a short window to institute a distribution network. But I told them, I said, let me tell you something. Just like y'all said that the Black men didn't care about their kids, which fatherhood matters, which you found out was a lie. Because Black men love their kids. They love their kids. I'm telling you.
Yes,
don't mess with my kids. See? So that's a myth. Let's get rid of that myth, okay?
All right.
But the other myth is that we rather bicker and be like crabs in a barrel than work together. But let me tell you, man, I have not ever seen as much love and and collaboration that I've seen with this lay distribution network.
Okay.
I am just thrilled. And the biggest thing I'm thrilled about is the Naloxone is made in Columbus, Ohio. The
Really?
manufacturer is here in Columbus, Ohio.
Locally based.
Hikma is locally based. So they are definitely in the game with us. And I am just I am just so proud, to be able to know that they're right here local. So again, man, so this with the network, then they gave us to September 29th. Let me tell you something, Brother Lloyd. we are each week we're bringing more people on because we have to get them fully trained first.
Okay.
Man, we started out with probably doing about 400 units a month in March. April went up about 600 to 700. May went to about 900. We're going to be up to almost 1,700 this month. And after next month, we'll be almost 2,000-3,000 a month, man.
Wow.
And that's without the network fully in place. So again, kudos goes off to the Ohio Department of Health, Project Dawn, and Sierra Dantzler is the director of Project Dawn, and I'm telling you, she has done a great job, and she was actually one of the brainchilds of this targeted community lay distribution network. So I want to make sure I give her and Hannah McDowell, who is my ODH consultant, if they're on the line today, or if anybody, their colleagues, let them know that I gave them a shout out, because if it wasn't for them, they wouldn't have went back for me to save our Black people.
Okay.
Okay.
Super shout out. So we'll give them their flowers right now.
Yeah. So again, if you don't have any questions, I think that I've been taking up enough of your time. And if you would show that number again, we encourage all organizations to give us a call. We want to have a kit of Narcan in every household. That's our goal. Our goal is to save lives. Our goal is to, when those statistics come back, they're going to say, yes, those people in Columbus turned the tide, made a difference, saved lives.
That's right.
And it's not like saving lives. And I always want to say that it's very humbling to, talk to your audience and to have the opportunity to share. And another shout out, while I'm shouting out, is the Franklin County and Franklin County Commissioners.
Yeah.
Kenneth Wilson, and the administrator, he's the county administrator, and all the commissioners. They are so supportive of what we do here in the field. They supported me from the beginning. I worked with the Franklin County Public Health, Teresa Seagraves. She's the health commissioner, and also with Malika Roberts of the Columbus Public Health. All of those guys are just so instrumental in our success. And I want to let everybody know right now that all of us are together. We are all together. We may be working different areas, but with me being grassroots, with me being out there on the ground, I got the big needle. I got the thread. And I'm going to thread all these agencies, everybody together into one neat little basket where we're going to get solutions and we're going to get results, because that's all what I'm all about, is results. And from an ex-quarterback, I'm going deep. I'm going deep, baby.
You're going deep.
I'm throwing bombs. I'm going deep.
All right.
Again, I want to thank you, Brother Lloyd, for letting me share with you some statistics, some facts.
Yeah.
And I hope that I've been worthwhile and worthy of being in your show.
Absolutely. Well, this is what I'll tell you, Brother Jordan. We really appreciate the insight, the knowledge, and the resources that you provided, because clearly this will save and can save many, many lives. I think awareness is where it all begins. And I believe that you probably helped to educate a lot of other folks besides myself tonight. So what I'm going to ask everybody to do, because we had some people watching on Facebook, we have some people watching on YouTube. I'm going to ask you that you share the links, right? Don't just hear this information and say, oh, wow, that was good stuff. No, take a moment, please, hit the share button and share it with your networks. We, especially in our community, we need to be fully aware of what is killing our community. And the numbers don't lie. The data says this is happening. We need to address this appropriately. We do have a resource that has been conveyed, and we appreciate what you have shared. And Brother Jordan, there was a question that came up that I wanted to make sure we address this evening as well. So clearly, what you provided is definitely a solution. And I think this is one that helps to address the issue, especially right there, real time, on the moment, to save a life. At the same point, we know that there's an addiction issue that exists. And when it comes to resources, as far as treatment centers and things like that, are there any resources to help from a long-term perspective versus that real-time, short-term to help save a life? How about save many lives long-term?
Well,
what does that look like for us?
I'm glad you gave me an extra dime in my meter. Because, see, we have a continuum plan, which once we see with the opiate community connectors with the LOH, we take people to treatment, right? We take them to Net Care, Mary Haven, Southeast, C&D, all these treatment centers, right? River Vista, all these treatments. But then what happens is you let them out, they detox. 3 weeks later, we're picking them up again. Okay?
Yeah.
So what I've done in working in conjunction with Global Life Chances Improvement Institute is to get those same people and bring them in and do a behavioral health assessment. Because
now we're talking.
Another area where we're not addressing, Brother Lloyd, is the mental health issues and the wounds that we all have as Black folks suffer from slavery. The wounds of slavery.
Trauma.
Isolation. What you call white supremacy. Redlining. I mean, all those little things that we had to go through.
Oppression, depression, all of that.
Oh yeah, all that is working. Not only on our mental health. Okay, so we will. And I've been fortunate enough to be a founder of Global Life Chances Improvement Institute, and we have 13 intellectual properties that address behavioral health, and Medicaid and Medicare pays for them from cradle to grave. Now, we've had some individuals, matter of fact, I want to be transparent here. I have a brother that been battling this addiction for years. I put him in treatment 2 or 3 different times. He's in treatment right now. I'm proud to say he's been in there for 3 months. He's doing great. He's been able to build himself back up. But what we had to do, we had to address his behavioral and mental health issues. We had to address those issues because it also the social determinants. The social determinants also play in whether if you ain't got nowhere to live, you ain't got no job, you ain't got no food, you ain't got no money.
Right.
And what you're trying to do is mask your hurt a lot of times. So you're gonna go do some dope. Now you don't expect fentanyl to be in it. You ain't trying to die.
Right.
But so the point that you're making, and the point that I want to make, and the point that I've been preaching is the continuum of services. Because even with Fatherhood Matters, see, once we get the men, then we get a behavior together, then we put them in the Fatherhood Matters, nurturing fathers, and then put them in 13-week of trying to teach a boy how to be a man, how to love, know what empathy is, know how to say I love you. A lot of men can't say I love you.
Right.
You know? So once you leave Thomas Capital Foundation, all of our programming, you're gonna be a whole person. And we also try to get you workforce development. But I'm with the county commissioner's construction inclusion team, and we have a program called Building Futures and Driving Futures. And over the last 4 years, we've employed over 100-something ex-felons on construction jobs, and they're averaging $40-some thousand a year. They're mainstream society now. They can look in the mirror and be proud.
Right.
Because all of us want to be successful.
Absolutely.
But what we do here is we meet people where they're at.
Okay. It's important.
You gotta meet people where they're at. And you can't have no false assumptions. Because you might see this guy, you think he's a crackhead, but on Monday, he might be that VP that gotta approve your house loan.
Could be. So we appreciate that. We appreciate the continuum and the resources that are available. We thank you for the opportunity to learn once again from you today. And we appreciate all that you're doing in the community to help save lives. All right. So with that, we thank Nathaniel D. Jordan II for coming on the show and breaking down this alarming overdose issue that's happening in the Black community as it relates to fentanyl overdoses. Okay, y'all. So make sure y'all spread the word, hit the share link. Now, as we wrap up, I want to thank everybody for joining us. Once again, this is ColumbusBlack.com's Wellness Wednesday, where we address the socio-economic impacts to our community. That could be education, health. It could be mental wealth as well, in addition to all the other things that impact our lives and our lifestyle. So with that being said, remember to check us out at ColumbusBlack.com, the website itself. Sign up for our email newsletter. That way you never miss out on an event or an activity like this. Follow us on Facebook, Instagram, Twitter, YouTube, and even on LinkedIn. That's right, y'all. We are everywhere. Nate just said it. We want to meet the people where they are. So whichever channel you're on, so are we. Now, with that, remember to download the Mile app. That's one of our sponsors today. Y'all can't see my full shirt, but there it is. MYLE stands for Make Your Life Entertaining. For things to do, places to go, and food to eat, just Mile it. And don't forget to post and promote and sell tickets to your events on Mile as well. And in the background, you'll see Venture Suite. Why? Because they're another sponsor. This is a co-working and event space right in the middle of the Bronzeville, King Lincoln area. So near downtown. If you have to have an event, you need a place to work, you need to check it out at venturesuite.co. That's venture, SUITE.co. Why? Because we are in the CO. With that being said, y'all, have a good night. And remember, in order to be more successful in your future, you need to understand a little bit more about your past. Did you have something else that you want to share, Nate, real quick before we go?
Yeah, here you go. This is what you're looking for right here.
That's what y'all looking for right there.
That's right.
So once again, y'all, remember, in order to be more successful in your future, you need to understand a little bit more about your past. That's why we just had Nathaniel D. Jordan II on with us, and I hope, just like us, you all had a blast. With that, have a good night. We're out. Peace.